I can chew anything, eat anything I want. There's no problem at all.
I don't know what I'd done without him. It's changed your life completely. Are you missing some teeth? Are you tired of dealing with ill-fitted bridges and dentures? Are you looking for an affordable solution? Here at the One Place Dental Implant Center, Dr. Lauren Lowen can help you get that smile back.
I know they're not going anywhere, and I know that I don't have to worry about them cracking and fracturing and coming off. I just, I just feel so much more confident.
Doctor, what is a dental implant?
A dental implant is an insert that goes in the bone. It's made out of titanium. It's an alloy, a lot like what you put in a knee replacement or hip replacement. So it goes into the bone where a patient has lost teeth, enables us to build a foundation, so to speak, so that we can put new teeth on that patient. Come in all kinds of sizes and shapes and different applications, but an implant is that insert that actually goes in the bone.
And then tell us a little bit what a mini dental implant is so people know the difference.
Yeah, so a standard implant is something that FDA approved over a certain size. So you go a little bigger, it's called a standard, then there's a size that we call a hybrid, which it's right in between, and then there's a size we call a mini. A mini has traditionally been designed to do with very minimally invasive procedures. But the interesting thing is now with standard implants, they're making them kind of the same way. Mm-hmm. So they're more and more designing implants that go in like a mini, and they're able to be used immediately more like a mini implant.
Who is a candidate for dental implants?
You know, almost everybody. There has to be a certain element of general health of the patient, of course. If a patient has an ability to heal bone, they're going to heal an implant. It's really not age limited. I've done them on people as old as 98,
really?
Believe it or not, and I've done them on kids probably as young as 13 is about the very youngest I've ever gone. Most everybody, as long as there's bone there and they haven't lost all of their bone.
Now, why would somebody get turned down?
There's a couple reasons. One is the bone issue. If they don't have enough bone there, we either have to make some bone by grafting and that sort of thing, or the other one is just if they're going through chemotherapy, something where they're very ill, that may not be a good candidate. And the other one is oral infection. I have a number of people that we do have implanted on, but we have to get their mouth generally healthy. So sometimes they come in with a lot of infection. They've got gum infection, they've got gum disease. Sometimes the solution is taking the teeth out, which cures the disease. Sometimes we have to go through some general maintenance issues that they haven't done if they've neglected their teeth for a long time to get them to where we can do the implant.
But they need to come in and find out.
They need to come in because a lot of times they think, oh, I'm so bad off, I can't do anything. Most of the time that's not the case. And a lot of times within a few months of treatment with just some basic things, we can get them ready to go. So it usually works out really well.
Tell us your whole situation and the issues you had. You had a lot going on.
For 6.5 years, I went to another dentist. Sorry.
It's all right, really.
It was terrible. I spent most of my time either crying or screaming at my husband because it was miserable. I couldn't eat. I couldn't do anything. My mouth hurt all the time. The top plate never fit. I finally went to a different dentist. And he took one look at my mouth and said, you know, I can't do anything with your mouth. And he sent me to another guy. And the other guy, thank heavens, looked in my mouth and said, the only one that can fix your mouth is Dr. Lowen.
That's pretty incredible.
Yes. And I made an appointment immediately. And I've been happy ever since. It's been wonderful.
It's incredible. Doctor, what did you see when Dot walked in?
For me, what I saw was someone who was just really struggling emotionally because of her teeth. She was really upset, and when that happens and someone comes in like that, your heart kind of goes out to them. You want to figure out and get to the bottom of what's really wrong and find out if you can help them, number one, and find out a little bit more about their story. So we had to start over. She had some implants, and there was issues that just, it wasn't going to be okay to try to fix what she had. Mm-hmm. So that's what we decided to do, and we did it over.
From beginning to end, when she first walked in here until it was completed, how long did that take?
Oh, I think we took about a total of maybe 9 months to complete everything.
Yeah.
We made her some transitional teeth and removed her implants, put in new implants, put those in her mouth, and let her get used to everything. And
Wonderful.
And then once
from
we
the first set of teeth,
we
from
made
the
some
plastic or wax or whatever they were, all the way through. They did nothing but get better every time.
How do you feel now?
I'm so happy I could just squiggle.
And look at that smile, Doctor.
She's ornery, isn't she?
I love it. Dr. Lowen, we want to get to know you. So what got you into dentistry from the beginning?
From the beginning, it was really my dad. My dad was a dentist, worked in a small town, and I thought I'd never be a dentist, but I started working for him. And I really liked it, and he taught me a lot of things, and I was like, I really want to do this. And so basically that got me going, working for him and seeing what he did for patients.
So where did you go for your training?
I went to University of Missouri in Kansas City, and well, that's where I got my basic dental training, and a lot of my implant training I got through a couple of different places that offer training for general dentists, more like a residency program type of thing. So got a lot of hours with working with some really good dentists in implant dentistry. So.
And after being in it for so many years, what have you found to be your passion? What is it that you truly love to do?
Yeah, the things I've really loved to do, I really love to do orthodontics. I did a lot of that for many years, and then implant dentistry. But the reason I like those things is because it can help people with their overall face, you know, the way their face looks, the way they appear, so that they look normal. And that they function normally, that they can eat and enjoy their food and basically feel good about smiling. That's really it. Really make them feel good about how they look.
And you've said some people have come in and even said, you've changed my life, or you've saved my life. You've changed how I feel about myself when I look in the mirror. That's gotta be an incredible feeling.
That's what energizes me to do what I do. Yeah, that makes me feel great that I'm able to do that for people, and that, you know, it affects their lives that way, so yeah.
I've always had a really bad overbite. And I went to a dentist in Hutchinson, where I'm from. Mike, you need to go see a specialist. And I don't mean a general dentistry, because most people can't deal with this type of dentistry. You're gonna have to see somebody that can do a little more than what a general dentist can do. And so I got to looking at it, and I seen Dr. Lowen's advertisements on TV, and I was telling my brother about it. He says, you know, we went to a dentist in Hillsboro that I think might be related to him. And I asked him about that, and he said, yeah, that was my dad. And it was like, wow, you know, I said, well, I'm gonna go to him then.
Doctor, what did you see when he walked into your office?
It was obvious that his bite was so bad, it was so severe, that we needed to find where is gonna be a place where his jaw is gonna live comfortably, and where is he gonna be long-term, where he's not gonna run into a lot more trouble. So yeah, that was the biggest thing. Other than that, his teeth were so severely worn that the front teeth were not salvageable. There was no way to plan that we were going to be able to save those teeth. On the other hand, some of the teeth in the back were really pretty decent, but he needed a complete, because his bite was so far off, he needed a complete rehabilitation of his bite to fix things to where it's going to be a long-term fix for him. So we had a serious discussion about some of these things.
We did.
And we came to an agreement, yeah, that this is what we want to do, and off we went.
How do you feel now that you have your teeth and you look in the mirror and you have a great smile?
Yeah, I could never imagine that I was going to get this done, and it feels great. I mean, it's natural, you know, it feels natural.
Doctor, you have state-of-the-art technology and equipment. What does this do?
This little tool is fairly new. It's called a spotter. It's a metal detector is what it is. So what we use it for is to find implants that are buried under the tissue. Yeah, so a lot of times when we do implant placement, we actually put the implant in and we sew the tissue over the top of it while it heals, because we want it to heal without any stresses or interference from the oral environment. So, but that means when they have healed, we need to go back and find that implant.
Right.
So traditionally, we've had to go back and take x-rays, or we just make an incision and peel the gum back again and find it that way. So this little tool is gonna detect that implant for me, so I can do a very minimal procedure.
Okay.
And just make a little punch through the gum instead of making an incision and requiring stitches and longer healing.
Yeah, much easier on the patient.
It's much easier on the patient, yes, it sure is. So how it works is I activate it first of all, and the little lights go on. Once it's ready to go, it's blinking. As I move it along, that blinking turns solid as I get close, okay? As I get closer and closer, if I find it, it's eventually it just turned yellow there for a second. That means I went too far. Okay. And when I find it right on the top, it's gonna turn green and beep.
Okay.
Now I'm exactly centered over the top of that implant. So what I'm gonna do, this has a hole in it. I'm gonna take a little thing called a probe, and I'm gonna slide it through the hole and actually feel the implant by poking it through the tissue a little bit, so I know that I can actually feel it and verify that it's there. And then I go, yeah, it's much easier. I go back and make a little hole, and I can screw in my piece called an abutment, which is this piece on this model that's sticking out of the gum, okay? So that's just another tool, makes things easier, more efficient, less pain for the patient.
And that's what we want.
That's what we want. We want it easier, right? This is another new technology, and it's done to tell me when an implant is ready to use. So this one uses resonance frequency analysis. It's called a penguin, because it kind of looks like a little penguin the way they colored it. So
it does.
That's the way they came up with the name, I guess. But anyhow, what the idea of this is we actually take a magnet. So if this is representing a patient's jaw, this is a model with some implants put into it. It's made out of plastic, but they're actual implant, what we call analog. So I'm gonna screw this magnetic piece. So if I was in the patient's mouth, this implant would be uncovered and I'd screw this little pin into the implant.
Okay.
So this pin is actually a magnet, all right? So then I'm gonna take my little tool, turn it on, and as I come close to it, it sends out a magnetic pulse, and it vibrates that magnet.
Okay.
All right? So the frequency that vibrates tells me if that implant is stable enough. It gives me a stability quotient. It's called an ISQ, implant stability quotient. So I'm gonna do that here just to represent what it does. And that gave me a number 82, is what it's reading out.
Right.
Yep. So I'm gonna do 4 places on every implant when I test them, because the bone isn't always the same on every side of the implant. So we're gonna get 4 numbers, 81, 80, and it's pretty consistent most of the time, 79. So,
And what's a good number?
a good number in the patient's mouth is over 60. So then I know that implant's good to go, but the higher the number, the more I know that that implant is more stable, so I can ask more of that implant, so to speak, and maybe do things differently than if it's a low number.
Okay.
If it's too low, I'm gonna let it heal longer. I'm gonna say, okay, the bone hasn't finished healing, we're gonna let it percolate a little longer, get more stable before we go and put something on that implant.
Tell us the issues you were having with your teeth.
My crowns were falling out, primarily due to bone problems and whatever, but they had root canals in them, and both of them, and the posts were not big enough for the root canal, and so it would just wiggle loose and fall out.
What did you see when you walked in?
So his story is pretty common, actually. Root canal teeth, they do get brittle. And oftentimes over the years, they've been reworked once or twice. And so it's kind of like anything mechanical. You rebuild it too many times, you start to run out of material. And so the structure of the teeth just wasn't enough to support the crown anymore. And so as we started talking about, well, okay, then we have options for this or this. And the implant was definitely for him by far the preferred option, because he had pretty good bone left, and it would be something cemented that he doesn't have to take out.
How do you feel now with your new smile, your new teeth?
Oh, it's great. I just, just feel like normal. I can eat corn on the cob, anything, and it's solid.
What would you say to people who are kind of on the fence, deciding if they want to do this, if they want to get implants? What would you tell them?
I'd tell them not to wait. If they can afford to do it, get it done.
Your clinic is absolutely gorgeous and state of the art. Will you show us around?
Thank you.
Okay,
Sure,
I want to
will
see
show
it.
you. Yeah. So here we are going into our first operatory.
Okay, very nice. What are you doing here?
So we have 2 operatories here. There's a mirror image of this one over on the other side of that wall. This is where we do maintenance of teeth, implants. My dental hygienist comes in here. We clean teeth here, do their exams and that sort of thing.
Okay, fantastic. And you have 2 rooms like this.
We have 2 like this. Maintenance of implants is just as important as natural teeth, so that's where we want to take care of the people who've done some of their work here.
Now this is a unique machine back here. What does it do?
Yes, that's our 3D imaging X-ray. It's basically a CT scan that we use to get all our initial data. New patients come in, we're going to take one of those scans so we can diagnose their bone and look in there. in their head, so to speak, and figure out what we can do.
It's a large machine.
It's a large machine. It's extremely nice. That particular machine is different that the patient sits and the machine kind of comes down and there's not a bunch of moving parts, which we really like about that machine. It's not an easy thing to do to take a CT scan while you're standing. So this is the next part of our clinic.
Okay.
And there's two operatories here. They're mirror images of each other.
And what are you doing here?
So these are smaller surgical operatories. They're bigger than what we were just in. They're smaller than our surgical op that we have for larger procedures. So this is smaller procedures, single extractions, implants, things like that, just a couple of them at a time or something like that. We can get all of our equipment in here. Everything that we need to do, all of that is just like in our larger surgical operatory. It's just a little bit smaller. So this is our main surgical operatory in this part of the office.
You do major surgeries in here.
This is where we do our bigger procedures, like an entire mouth of extractions, implants, that sort of thing. We have a big screen. It just makes it easier because the room is larger, so I can visualize everything I'm doing off my CT scan. We have room in the corner there where we can have our anesthesiologist come in here if we're going to put people to sleep. So it's a very handy operatory where we can do more and be less stressed. Let's just put it that way. Okay, here we are in our consult room.
Okay, you bring all the patients in here before you do any of the procedures and just talk about the plan, the process?
That's right, that's what this room is for. So anytime we need to talk to someone about something that needs to be private, a lot of times people will bring family members along. We're gonna go over their treatment plan, and especially, you know, a lot of plans are something that you don't want to be talking about out where maybe other people can hear you. So it's a really nice environment that's a lot more relaxing than the rest of the clinic is. And we can show them their pictures of their case, show them whatever planning we've done digitally on that screen right there, and go over their plan and have a conversation about it.
Okay, doctor, tell us about this technology, and this helps in the planning process before you even start operating.
So this is the virtual rendering of a CT scan for implant planning. So this is a screen that shows, this is what I do most of my work with right here. It shows me the patient's bone volumes, how dense it is, how dense the bone actually is, where I'm gonna put my implants. I plan out on here before I go into surgery, all right? So on this screen, you see all these white things on here that look like little bolts. So these are virtually placed implants in this patient's jaw.
Okay.
So the red thing that you see coming down here, this is the computer has a tool that helps trace the main nerve and artery that goes through the lower jaw. So we always want to avoid that. You can see all these implants are pretty far away from that. This particular technology is extremely accurate. It's within like 1/10 of a millimeter or less. It's going to tell me exactly where I'm at.
Okay.
So it's really good in accuracy. I really like that about it. Saves me a ton of time, and I can measure between each implant and see how far apart they are. There's a measuring tool here. I've just measured between the front two and it tells me the number. I basically measure between all of them and I make a little map that I use during surgery.
And yeah, this is what you're looking at during surgery.
This is what I've pre-done, and I'm looking at this during surgery. I've put all the implants where they need to be, so the teeth are going to actually fit where they should fit, so the patient looks normal when we're done.
And you said the planning process, doing this, takes longer than actually doing the surgery.
It does, yes it does. This is the majority of my homework that I end up doing, is planning these cases on the scan and getting everything to look right on the models, the modeling and everything that we're going to use to make that case work. So it's all done ahead of time behind the scenes, so when you get into the procedures go well.
You had a lot of issues when you got here to Dr. Lowen, and you were really frustrated. Tell us what was going on.
The problem was it was time to do something. My teeth were getting bad. So I had gone to a dentist to get the process started. I did get the implants done. I got the new dentures. After the whole process was finished, nothing fit correctly. I couldn't eat. I didn't like the looks of it, and I was just so embarrassed over it. And I don't really know how I came across Dr. Lowen's name, maybe on one of his commercials, but knowing that it was one place. I didn't have to go to 2 different places, that he did everything. And so that's how I ended up coming here.
What did you do for her? How many teeth?
So she had some implants in her mouth that actually were usable, which was a good thing, but she didn't have enough support for her lower teeth. So they were moving around. She needed some more implants, so we planned in 3 more implants, and ended up spacing them out so she would get that support, so the denture wouldn't be rocking around and moving around so much, and changed out the attachments so everything was fitting right, and made her new teeth. She needed a whole new set of teeth because we'd lost her face. Yes. She didn't have her face. You know, when I have a patient like that comes in, sometimes it's hard for me to know what should you look like. And so we usually have them bring pictures or things like that to help orient. Okay, this is what you look like. Okay, now we know kind of where we need to go. And we go through a process of try-ins, of making teeth and fitting them and saying, okay, this gets you back to where you probably ought to be.
How did you feel after the first consultation with Doctor?
He's a miracle worker. You know, he from what he's had to start with to what I ended up with is night and day. And, you know, he assured me, we can get you back to looking like you. And he did.
And how's that make you feel when you look in the mirror?
Oh my God, it's different, yeah. It is, it's a new life.
So if you have a patient sitting here, then how do you use the digital scanner on them?
Right, so a digital scanner is data collection. So if we're gonna make something for the patient, like a crown or an implant supported crown or a bridge, then we use this camera in their mouth, and it's a laser scanner. So basically, it takes a photographic image at the same time that it scans it with a laser. So it's all digital to get data onto this screen so that I can plan what I need to plan, and then I send it to the lab, and then they actually use the data file to make the teeth.
Okay.
Okay. So what you see on the screen right now is a fully scanned arch on a patient where there's 8 implants in there. It's actually a patient we've talked about the little bridge before. So this data here is used to make this bridge that I'm showing you right here.
Okay.
So it makes a model that looks kind of like that picture. All right. So I can take this and I can move it around. I can blow it up. I can make all my markings where I want the teeth to fit against the implants. So it has a lot of tools on it that I use for my part of the planning, and then the lab gets it sent to them.
And then it lets the patient see what's actually being done.
Yeah, I usually try to show them this so they kind of get a handle of what's going on and what's happening to make their teeth. It's kind of a neat tool for them to understand it a little bit.
When I was about 5 or whatever, my teeth were falling out and coming in. Some of my teeth that come in at the time were coming in kind of bad and rotted, not straight and stuff. So as I grew older into my teen years, I kind of got discouraged about taking care of them and keeping track of them and stuff. And then led into my adult life, had a child, family, stuff like that. And before I decided I wanted to do anything with myself, I wanted to get her raised up and out of school. And then now I'm in my early, mid 40s or whatever, and decided to take care of myself and get me some new teeth. So,
Doctor, what did you have to do with him when he walked in, and what kind of case did he have?
Yeah, you know, like he just described about his teeth were just deteriorating, and it was pretty advanced by the time he came in. So it was one of those we call a no-brainer, of course, because it was like there's just basically there's no way we're gonna try to keep putting him through restoring these teeth, and he had been through a lot. And so it was obvious that we needed to remove all the teeth.
Do you feel like you smile more now?
yes, because I would actually admit that I had a hard time showing my teeth, you know, embarrassed or whatever. But now, no problem. Yeah, I smile, laugh a lot.
Yeah. Looking back at the process and over the last year, how do you feel like it's gone?
Great. I'm genuinely amazed. You know, it's made me more confident. I can eat, you know, what I want, when I want, and yeah, just great.
Doctor, when you have a patient come in and they have no teeth at all, what can you do for them?
Yeah, we have a couple different options. There's 2 that we use quite often here. I'm going to show you one of them, okay? So this would be an option we call a snap-on denture.
Okay.
So it's an option where a lot of times, I'm going to pull this off here. So this is representing the patient's jaw, even though it's clear. You can see implants going down in there. These are actual implants that are put in here.
Right.
And then in this scenario, we make a denture, and the denture has an attachment inside of it.
Okay.
So there's an attachment in there that snaps on to these are called ball heads on this one. There's a couple different types that we can screw into the implant to do the dentures. This one is one I use probably the most commonly. But you just take the denture and they align it up in their mouth and they snap it on.
Perfect.
They eat 5 times better than they do with a denture without implants, okay? So it's not like natural teeth yet. There's another option we have for that. But it's a lot better than going with a denture that just swims around in the mouth.
Right.
Okay. So they usually feel like, oh, I've got my mouth back. I'm eating normal again. Is the typical response I get from patients. This one happens to be cost effective, so we do a lot of these.
What issues were you having when you came here to see Dr. Long?
Well, I was having some real problems with some veneers that I had put on several years ago. And just continuously cracking, continuously falling off, and it just, I just couldn't function well with them. I don't know what it was exactly, but they were not for me. This would not work, Jamel.
And doctor, when you saw that when he came in here and visited you, what did you think? Where did you start?
Well, I always have to evaluate somebody independently because he had been already to another dentist. They'd already talked about possible solutions, and he didn't think that he wanted to continue going through replacing these crowns, or veneers. So I just have to evaluate, and it was pretty obvious the reason they weren't staying on was because there simply wasn't enough tooth structure left to hold them. So we have a discussion, well, there's not a lot of options at that point. If we keep doing this, it's just doing the same thing. And implants were, he's got great bone. He was a good candidate for implants. So we had that discussion, and that's the direction we went to.
And Don, what made you pick one place?
Well, actually, I did not want to go to one of those large corporate dental offices. I was just looking for something more I don't know, more personal, one with like I have a relationship with the doctor, and I just had confidence. I think maybe I saw one of Dr. Lowen's commercials, and it just struck me. And I said, I got to try this.
How did you feel after the consultation?
Oh, wow. Very confident, very, the staff here and with Dr. Lowen just made me feel so comfortable, and it was all just very professional. I liked his demeanor when he was visiting with me and such, and so I was sold.
And tell us about the pain. Was there much pain?
Actually, there wasn't. I was surprised. I don't recall a lot. I really don't.
Okay, so Don, when you smile now, when you look in the mirror and smile, how do you feel?
I know they're not going anywhere, and I know that I don't have to worry about them cracking and fracturing and coming off. I just, I just feel so much more confident in smiling and even sitting down to have a nice dinner with my wife. Thank you for coming up with a solution that was going to fit me for the rest of my life, really.
Now, doctor, how are implants used to replace teeth?
There's a lot of ways. We talked about snap-on teeth earlier. So there's the denture application where we stabilize a set of dentures for somebody who has no teeth. There's putting one tooth back in. Someone knocks a tooth out in an accident, something like that, or multiple teeth. They're great for those applications, or even replacing a whole set of teeth. I mean, there's all different ways. Basically, as long as there is bone, we can replace teeth.
Call today and let us help you smile with renewed confidence. One Place Dental Implant Center. Remember, it's never too late to make a difference in your life.